For those of you who don't know me, my name is Anusha Jaram. I'm currently a rising fourth-year student at Tufts University School of Medicine, and I'm currently also one of the research associates at the Harvard Program in Global Surgery and Social Change. And finally, I'm also one of the national co-chairs for the Global Surgery Student Alliance. GSSA is the US National Working Group for Incision, which is the International Student Surgical Network, and a really amazing community of medical students and trainees who are, fighting for surgical access around the world as well. So we're extremely excited to have everyone here tonight to get more insight into this USAID appropriations campaign that we have started in coalition with a number of other groups, many G4 Alliance partners such as Mobile Surgery International, Charity Vision, as well as the Harvard Program in Global Surgery and Social Change, American College of Surgeons, and many others who are, still imminently joining. So I think it's a really, really amazing program that we have so far. Tonight, we're going to have an overview of this process, the history behind it from Lismore, who has been putting in a ton of groundwork these past few years. And then we're also going to be hearing from Vincent, who will be going over some of the more advocacy related work that students, trainees, and anyone really can get engaged in. And then we are going to have some time for a question and answer session. And we also have some really awesome guests here with us tonight. We have Ambassador Kolker, who has been a huge champion for global surgery. So super excited to have him here. And then we also have Dr. Key Park, who has also been one of the spearheaders for this. And I see, is it Dr. Laura Hoemeke? I realize that I'm not too sure about that. I want to make sure that.
That's okay. It actually is. Thanks.
Awesome. Well, we have Dr. Laura Hoemeke with us here as well, who's also been one of the leaders within this movement. So really, really excited. And finally, we also have Michael Nebeker here. So lots of people to answer all the questions that you may or may not have had coming into this. We're going to deliver some really interesting information. And we really hope that you write some letters, meet with your elected officials, get your partners to write these letters, get your friends to write these letters. I know I've been texting all my friends and family all day to get them on board with this. So hopefully we'll give you some tips as well in how to engage in all of this. So without further ado, I'm going to introduce Lismore, who is going to go over the history of this process and where we're at.
Hi, everyone. My name is Lismore Nebeker. I am the Director of Research and Public Policy for Mobile Surgery International. We run a mobile surgical hospital in Oaxaca, Mexico, treating children with cleft lip and or cleft palate facial deformities. And we started this appropriations process a little over 3 years ago. I am going to share my screen. It's been a remarkable journey, and we are truly grateful for all of you that have been willing to get on board and hear about what we've been working on. It really is exciting. It's also a landmark experience for all of us that are involved in this to see this language about global surgery come together in the United States government appropriations bills. We are advocating for a $100 million allocation to be made for global surgery under the header of neglected surgical conditions. So we have a remarkable coalition, as Anusha described. We have a lot of the groups that you see here on the screen involved, advocating, sending letters, speaking with representatives, joining us on letters of support to kickstart what we hope to be the beginning of a remarkable journey for global surgery, with the funding needed to take care of the patients around the world. Why champion $100 million for neglected surgical conditions? As I'm sure many of you know, we have 17 million people that die every year from lack of access to safe, timely, and surgical care. The time to address the major gaps in surgical obstetric trauma and anesthesia care is right now. So I'm going to give you a little bit of background on the U.S. government appropriations process. There are 12 appropriations committees within the United States government, both on the Senate side and the congressional side. Members of Congress are a part of these committees and make the decisions of where funding is going to be allocated. And this applies to all different types of things, both here in the United States as well as abroad. The funding for USAID, which is the United States Agency for International Development, is funded through the State and Foreign Operations and Related Programs Appropriations Subcommittee. I know this is a lot of information. The committee is also shortened to what's called SFOPS. So the SFOPS Appropriations Subcommittee makes the decisions about where money is going to be spent abroad. This includes the State Department, this includes USAID. With the new administration that has just come in, they have gone through the process of walking through every item of the budget and figuring out what type of things they want to spend money on, what types of things they don't want to be spending money on. And then the committee will go over the president's budget with a fine-tooth comb and then make decisions about, again, where should we be spending money, where should we not be spending money, and adjust accordingly. So this was the language that we received in the fiscal year for 2020. It started with neglected surgical conditions. The committee directs the USAID administrator to support treatment and training to address such health issues as cleft lip and cleft palate, clubfoot, cataracts, hernia, fistulas, and untreated traumatic injuries in underserved rural areas in developing countries. So the following year, we built upon that language and expanded it with the help of members of the G4 Alliance, Harvard's PGSSC, and a lot of great input from really remarkable figures in the global surgery space. So our final language for fiscal year 2021 read, neglected surgical conditions. The USAID administrator shall support efforts to strengthen surgical health capacity to address such health issues as cleft lip and cleft palate, clubfoot, cataracts, hernias, fistulas, and untreated traumatic injuries in underserved areas in developing countries, including in contexts without water or electricity. Strengthening surgical health systems includes the training of local surgical teams to provide safe, sustainable, and timely surgical care, and assisting ministries of health to develop and implement national surgical, obstetric, trauma, and anesthesia plans. So I want to clarify that we understand that these 6 conditions is just a starting point. We understand that there are a number of other global surgery concerns, priorities, professions, specialties that we want to have eventually included in this global surgery umbrella. Neglected surgical conditions is just a starting point. These low-cost, low-risk surgeries, in comparison to other interventions, was a way for us to begin the process of receiving a funding allocation. The way that our Washington Council refers to this process is as if we were planting an oak tree. And right now we are watering our wee little acorn that we've planted in hopes of growing an enormous oak tree with acorns to share with the entire global surgery community. And we understand that, again, this is just the beginning. This language we have taken for fiscal year 2021, which is going on right now, and are resubmitting the same language for fiscal year 2022 with an ask of $100 million to be allocated. So this is the starting point. We really wanted to make sure that national surgical planning was a part of this, as well as strengthening surgical health systems. With the ongoing pandemic, we want to maintain a narrative that improving and strengthening surgical health systems globally will help with future pandemic interventions as well. And that if our healthcare system here is strong and healthcare systems are strong abroad, we will have a much easier time when facing things like a global pandemic. So again, these are the images that we've been using in communicating with members of Congress to describe these conditions. And here is our proposed report language for fiscal year 2022. So you'll see that the $100 million request is a part of that language as well. These are the members of the Appropriations Committee on the Senate side. The chair of the committee is Senator Chris Coons. The ranking member is Lindsey Graham. We have met with staffers and or members of the committee over the last couple of years. There's been a bit of changes going on with the new leadership and administration, but we have had a lot of really remarkable response from both sides of the political aisle. Republicans and Democrats coming together to understand what this issue really means, really understand the global need, as well as getting specifics on country to country information as countries have come up with their own national surgical plans, etc. These are the members on the House Committee. And the way that our meetings have worked have really gone back to the very beginning of the global surgery movement. There's a lot of different points that you could jump to. Where we started in Washington was the 2015 Lancet Commission report on global surgery. It was a landmark study that was a turning point for a lot of public health movements to understand that this needs to be a priority. And we took the Lancet Commission into a lot of these congressional offices and walked them through piece by piece every sort of finding and understanding of what the true burden of global surgery is. I will pause there for questions and or to jump over to Key. I want to make sure that I'm keeping this concise. I hope that gave everybody a bit of a good background as to the appropriations process. But as we discuss further, these committee members on appropriations is who we want to contact, as well as local representatives for the states that you guys live in. Members of Congress are coworkers. They communicate with each other often. They pick up the phone. They talk to one another about issues that are going on in their states, abroad. And these letters of support are going to become a extremely crucial component to this initiative. By having you guys write letters and express the true need for a global surgery USAID budget, it shows these members of Congress that their constituents, the people living in their states that they take care of, take interest in this language. So the more people and the more letters and the more phone calls and the more communication that we can have with the offices shown here, as well as leadership from all across the country, this will become a priority for them. If they can see that it's a priority for us and the communities that we serve, as well as the patients that we all serve, this will become more and more serious to them, and they will see the need to add a funding allocation. Anusha, I'll jump back to you. Let me know if you have any questions or things that you need me to clarify.
I don't have any questions right now. Does anyone else have any questions? We'll have some time for question and answer at the end of the session, but also right now, while people are digesting this information, if anything comes up, feel free to unmute your microphone or paste a question in the chat.
Yeah, I actually do have a question. So what does building that base of like surgical services actually look like on the ground?
You mean in terms of interventions?
Yes.
So there's obviously a lot of different nonprofit organizations all around the world doing remarkable surgical initiatives. Essentially what we would be doing is creating funding so that eventually people could apply for grants to fund their surgical programs. In my case with Michael, as we run Mobile Surgery International, this type of funding would go towards treating cleft lip and or cleft palate, where this language began, because that is our background. And Michael and I have worked in the cleft lip and cleft palate space for over a decade. But those interventions will vary based off of country priorities, which is why we wanted to bring national surgical planning into this language and working with ministries of health. Key, I don't know if you want to jump in and talk about this as well, but making sure that we are maintaining communication with USAID offices locally in countries and making sure that their surgical priorities and the needs of those specific countries are being attended to. So it will not be the same for any two countries or initiatives or funding allocation, because you have so many people around the world with different priorities and a different layout of how they see this working. A really important part of our language from fiscal year 2021 is the directive saying the committee directs USAID to treat this, essentially. That this was a really clear directive saying, we understand that this is a priority for countries, but we also want to get feedback from local USAID offices and ministries of health to help sort of change the trajectory of what surgical priorities become the most important.
Excellent, thank you.
Yeah, Any other questions? Key, do you have anything you want to add?
I can wait till the end. I think, Anusha, it's up to you.
You're welcome to add something now if you want to. And then also, I know that we had a couple of questions in the registration forms that Ambassador Kolker had also prepared some answers for, and I think it also fits in really well here. So Ambassador Kolker, if you want to elaborate a little bit more on those questions as well.
I always want Key to go first, so I will learn from him. And I think that the role of the national strategies really is key in the answer to Preston Jenkins' question.
Yeah, I'll say something. So yeah, Lismore and Ambassador Kolker is right. So, you know, PGSSC, we are working with a number of countries directly with their ministries of health. 16 countries in the Southern African Development Community, some West African countries, some of the East and Central African countries, as well as over 30 plus countries in the Western Pacific region and some in the Sierra region. So there's a huge number of ministries we engage with directly or indirectly. And we've shared this language, the appropriation language with them. And at least 2 of them have already met with the mission. So one is Fiji. The minister himself met with the acting ambassador and the USAID representative specifically on this language and how they could support their national strategic plan for surgical care, because it's in that language if you look at it carefully. And I think Nepal is either has met or planning to meet with the USAID representative as well. I'll stop there.
And perhaps before Ambassador Kolker, I just wanted to say from the perspective of a former USAID employee, I was at the USAID mission in Benin for 4 years as the health advisor many years ago. If someone had come to me saying we have a surgical care plan, the answer would have been no, quite honestly, because it would have been, it doesn't fit in with our sort of earmarks around maternal and child health, infectious disease control, HIV/AIDS, malaria, etc. So I think even without an earmark, having that language in there as a directive to USAID is huge. And part of the goal, in addition to educating Congress and really advocating to Congress, is also really creating awareness among the USAID community, especially at the level of country missions.
I guess one of the questions that came in the registration was about whether by asking for $100 million specifically for surgery-related interventions, whether that means that there has to be a trade-off, that's something we're asking USAID not to do or not to prioritize. And the answer to that is no, although USAID's budget is clearly finite. And if they spend money on surgery, that money could have been used for something else. But because the administration has requested, I believe, a 14% increase in the global health budget for USAID, this ideally would be on top of things that are already going on or things that could be double counted. And that already, the language which did not have a figure attached to it, I think helped result last year in a allocation going for fistula control through the maternal health budget. So this was money that was designed for maternal health, but has now been designated for countries to increase the coverage of fistula care, which is a surgical procedure, so that and it has to do with maternal survival, very important priority for all of us, including for USAID. So this would allow other people interested in health system strengthening of looking at how the ICUs, anesthesiology, surgical interventions have actually been helping to surge in the COVID response. So this could be part of the COVID response. It doesn't mean that these are programs that are competing with other priorities that USAID has. It could just mean that they have more incentive to include surgery in what they're doing in other programs that may have to do with infectious diseases, may have to do with non-communicable diseases, or with health system strengthening in general, training of personnel, and other things. So this is additive. It is a specific amount. It does mean that money that we hope goes to surgery is not necessarily available for other things that USAID might have come up with, but there is room within the appropriation for this not to be at the direct expense of some other priority, which we have to identify as an offset.
I would only add, build on Ambassador Kolker's statement that the global surgery community, I think this particular team here, we will discuss, advocating for the overall increase in the global health budget. And I think, we've joined Global Health Council. I know G4 is a member of it. Vincent connected us with them. And so I think the intention is to all of us to advocate for increasing the overall global health budget as well.
Great. Thank you all for all of that insight. This is definitely not stuff that we learn in medical school or dental school or residency. And so, these are the spaces in which we learn more about what we can do as, members of the healthcare community. So for now, I think I'm going to take a pause in the questions, but everyone, please be thinking of more if you have any. Feel free to put them in the chat or just save them for an open mic once we get to that section. Next up, I'm going to be introducing Vincent Lin, who is with Partners in Health, and he'll be talking to us a little bit more directly about the different kinds of advocacy work that you can engage in to get some of these funding.
Great, thanks so much. Can you all see this screen? Okay, great. Awesome. Cool. So yeah, thanks so much, Anusha, for having me. Really excited that you all are interested in this work, getting engaged civically and getting involved with the appropriations process and talking to your members of Congress, starting to build those relationships. So I'm going to do a little bit of a zoom out on where we are in the appropriation cycle and how the process works as a whole. And then can take questions afterwards or at the end. I'll also talk a little bit about the methods or tactics that you all have laid out to use this spring and then also for future years. So first question, what part of the federal budget are we working on? Lismore mentioned the SFOPS Appropriation Subcommittee. How does that fit into the overall annual budget? So if we look at the 2019 federal budget, there's within the outlays, there's both mandatory and discretionary spending. Discretionary spending would be optional spending that is decided upon every year. This includes both defense funding and non-defense funding. And within the non-defense funding, the diplomacy and international affairs budget in 2019 was about 8% of that. Non-defense discretionary spending overall was about $626 billion in the last fiscal year. And for the last 10 years, there have been fiscal caps on how much money can be spent overall in discretionary funding. And so FY22 is a term you'll hear a lot, fiscal year 22. This actually refers to the federal budget from October 1st to September 30th of the coming year. And typically the appropriations timeline with the administration will look something like this, where the agencies will prepare proposals in the summer. In the fall, they'll submit those proposals to OMB. In November, the president will give feedback to the agencies in a passback cycle, and then there will be final submissions to OMB from the agencies. And then typically in January, the president will outline the budget priorities in the State of the Union, followed by a budget request from president to Congress. Congress has the power of the purse, so they make the ultimate decisions, but they sometimes follow the recommendations of the administration. And so these last two steps have been delayed this year. So, as we look forward to future fiscal years, you might see different timings. So that's just something to be aware of in the future. And so, where we weigh in as advocates with the methods that we've outlined and that are on the GSSA website are really trying to connect with our members of Congress as they're considering the SFOPS budget for the next year. And so that's both, that's really working in the time between when the president submits his or her budget request and Congress really marks up those bills and comes to a final decision on where exactly the money will go. Dr. Hoemeke mentioned the earmarking that goes on between the different programs. And so this is something that happens where the SFOP subcommittee is actually making those deliberations about, how much funding is going to go to neglected tropical disease this year within USAID, or to maternal and child health, as you mentioned, or tuberculosis, for example. And so we just saw recently the president's fiscal year 22 discretionary request come out. We expect a more detailed request to come out in early May, but this request, as the ambassador mentioned, provides an increase in the funding. Some of this is more pointed to global health security in the current environment. But as he mentioned, the health system strengthening work that comes through funding SFOPS and improving the human resources for health, putting funding into building out full health systems is all synergistic with a global health security approach and being ready for the next pandemic. And so a little bit just on our FY22 request, or the GSSA FY22 request. As has been mentioned, there hasn't been a line item for surgery before. And so you can see here's the approximate amount of money that has gone in each year to global health funding from the US government from 2006 to 2021. And in the last year, fiscal year 21, at 11.4 billion total, you'll see that there wasn't a surgery specific line. And so that's the contribution that you all are working to make here. And I think that's really cool. And so you all mentioned some questions ahead of time about, how do we do this advocacy well? What are the methods by which grassroots advocates can really make an influence on their members of Congress? And so a lot of you all are med students now, or undergrads, and have a lot of time to come in the years to come to develop these relationships with your members of Congress. And so there are really three ways this spring that I think the GSSA is hoping that you all will do this advocacy. So one method that I think maybe is something that we can work on in the future is direct MOC requests from constituents. And so these are often a Google form or Word document that you submit your exact request, the language of the request, how much money you're hoping to receive for which line item in which program. And these are often submitted via Google form on the members of Congress's websites. And so they'll scroll through those and figure out what their constituents care about in a given year. Another method that I think you all have laid out really nicely on the website is how to do meetings with members of Congress and their staffs, how to write great letters, and how to make effective calls. And then the last thing that I'll point to that I think folks have been working on are appropriation sign-on letters, also known as Dear Colleague letters, where members of Congress can sign on in support of a certain allocation. And that letter will actually go to the chairs of the SFOPS subcommittee. And so they'll hear from all of their colleagues in what's essentially a petition that says, we all want this much funding for this specific priority. And so this is a bit in the weeds, but members of Congress surveyed along with their staffs have said that over 90% of them have said that meetings from constituents, and now those are all done over Zoom, have some or a lot of influence. And that staff surveyed also say that getting to know the legislative assistant who has jurisdiction over the specific issue area, so for example, the foreign policy aide, or often the health policy aide in representatives' offices, for example, those are the folks you want to get to know over the coming years, and folks who will come back to you over and over again. They'll give you phone calls, they'll send you emails when they have questions, and that's someone that you can get to know over time. And so you just wanted to shout out all the great work that's been done already in developing the various materials for how to write to your congressperson, and also how to meet your congressperson, which can be found on the GSSA website. So I'll stop there for any questions, and we can also do questions at the end if that would be better.
Does anyone have any questions right now? Okay, then I think what we're going to do is move on to Tara, who's one of our VPs of advocacy, and has been a key part of the team that's really put together all of this content on the website. And Tara is going to go through the website and its resources just so that like the students and trainees and everyone else that's here that is thinking of writing a letter has a better idea of how that website works. We've tried to make it as simple as possible, but there are a few nuances, and so she's going to be taking us through that. Tara?
Good evening, everyone. Let me share my screen. Can you see my screen? Awesome.
Yes.
Okay, so I just wanted to show everyone how you can access information about your Congress people and the letter. So if you go to the GSSA website under news and events, there's the USAID campaign. And then if you click on that and scroll down, it shows you step by step how you can do this. So the first thing is to download the letter. You can do a letter that is generic or the one that has the GSSA letterhead. So I'm going to do that. And then this Word document will show up. This is the letter that you're going to send to your representative or your senator, and you can edit it, add your Congress person's name. And then if you scroll down at the end, it has your name, information about you, your job title, what school you go to, and your contact information. Something that has been a little difficult for some people is finding the emails of the senators and representatives. So if you go to find email, it will take you to this page, results.org. So you can just type in your zip code, and then it's going to ask you to actually type your address. And for some reason, it didn't find my address first. Okay, sorry, let me do this again. And then it's going to show you your senators and your representative. And then this is the part that can be different for each state. So I'm going to pick Senator Warren as my first contact. If you just click on the name, it's going to show you how you can get into the website. So if you go to their website, so for each senator and representative is different. So this one is a little tricky, but all of them have a contact page. So you want to go to the contact. And then for Senator Warren is share your opinion. But all of them have this form, and it's a little sometimes not intuitive. So you want to put your information, so your last name, your number, your address, and all of them ask you to do a topic and a subject. The topics are different for each senator and representative. You can do budget, you can do funding. Some have foreign relations, some have foreign affairs. So depending on what the topics are for that senator or representative, you want to choose that. And then the subject is something that you are going to write. So I have been writing USAID funding or USAID budget. And then you can go back to the Word document and just copy the whole thing. And then you can just copy it on the message, but you want to make sure that you go and you complete it. So if I want to do this and send it to Senator Warren, I want to go and make sure that I'm sending it to Senator Warren. And then I want to make sure that I scroll down and I write my name, my school, my job, and my information, and then you would submit it. When you're done with the first one, you want to go back to that result page and then do the same thing with your second senator and the representative. So if you are in Boston, for example, you want to go and do the same thing for Senator Markey and Ayanna Pressley. When you're done with this, we ask you to go back to the GSSA page and then fill out this report form so we can track who actually has been doing that and how many letters of support we have sent. So I guess the reason that we wanted to do this with you is each representative and each senator's page is different. So it doesn't take a long time, but be patient. Make sure you go to their web page, make sure you look at their contact, and then you find their contacts and send them messages. And if you have any questions, you can email me or GSSA or anyone in the advocacy team, and we're happy to help you. But it's pretty easy. I did it. It did not even take 10 minutes. They are our elected officials. They want to hear from us. So let's make our voices heard. I'm happy to answer any questions.
Thank you so much, Tarek. Not have said it better myself. Also, you know, the contact emails has been an interesting thing that we've all learned about. I think a lot of these elected officials' offices are moving towards like contact pages that you might see on a website. So if you really can't find an email, you can also use those contact pages. Almost all of their websites have them. One thing that has come up, Vincent, actually, that we're hoping to ask you is, a lot of them have like a drop-down list for like topics to pick about like what are you writing about. And so a lot of them have a health, and then they also have a foreign affairs option, and we're wondering which is the better option to go with.
If they have a foreign affairs person, generally, that's the person who will be point. You'll notice that the Senate staff lists are much larger. The senators are able to hire much larger staffs. Often for representatives, the health policy person covers the entire portfolio, including global health. But there are actually some senators' offices, like Senator Coons, for example, whose health policy team actually also covers global health, although his foreign policy team covers most of the other issues in foreign policy. So when in doubt, I would just email both.
That's good to know. Thank you.
You can never send too many emails.
Does anyone have any questions at this time? I think Vincent did an amazing job of breaking all of that down and just going over like the major deadlines and like, why are we doing this now? Which I think is always an important part of, you know, understanding this process that can be incredibly complicated for all of us. We have a question in the chat. Thank you so much for joining us, Dr. Hoemeke. So we have Bassem, who's one of our undergraduate chapter leaders and has been an awesome team member. He is saying many of our chapters have advisors who are surgeons. Is there anything additional that we could ask them to do to help advance this campaign?
I think the number one recommendation that comes to my mind is if you can put a letter together with multiple surgeons on the same letter and or get approval from whatever hospital that you're working at to have it be a letter of support from that hospital, it only strengthens the voice. If it's just a letter from you and your co-residents, that is great too. But the more people that you can get to get involved with these letters, the better. If there's a member of Congress or a representative that responds back to your email and you request a time to meet with them or discuss, that is fabulous. The face-to-face time, whether that's on Zoom or just a phone call, is a great opportunity to express your personal experience as you are becoming a surgeon, or if you work with surgeons that want to talk about their experience and understand why this is such a big issue. That is well spent time. If those phone calls feel intimidating or things that you can't do on your own, myself or Michael or a number of other people that are on this call would be totally willing to jump onto those types of calls with you and or walk you through what those types of phone calls look like. Meeting with senators and congressional staffers, a lot of them are, I don't know everyone on this call, but in and around young aged post-undergrad, working on the Hill, are really energetic and really passionate about what they're working on. And the more meetings that I take, the more approachable these discussions become. And you're able to talk about them with ease. And all of you are so passionate to be on a Zoom call on a Thursday night at 8 p.m. I I feel that is very inspiring in and of itself. And so for you guys to have a chance to share your experiences with your members of Congress is actually a really remarkable experience. And so if there's anything that we can do to support you in this, please feel free to reach out. I will put my contact in the chat as well. And we want to make this as cool of an experience for you guys as it has been for us. And we look forward to seeing all these letters and communication come together.
Lismore, can I jump onto that to say that you ask what the surgeons themselves might be able to do. The elevator speech for this is that if you live in the United States and you have a condition that's correctable by surgery or able to be dealt with in a surgical context, your chances of survival are very high. If you're living in the majority of countries in the world, your chances of survival with that very same condition are low. So I think that you as medical students and surgeons themselves are in an ideal position to make that scientific argument. We're not looking for scientific breakthroughs. What we as Americans, I think, have a moral and ethical kind of responsibility is we know what to do. We're good at what we do. You're good at what you do. And we want to share that knowledge with others and be sure that others are able to take advantage of benefits that we're providing to patients in our hospitals and our clinics every day. And so I think surgeons and medical students are particularly poignant in saying, you know, I did 6 surgeries this week. But if these same patients were living in Burkina Faso, where I was the ambassador, none of them would have been able to benefit from that service. And here's a chance that we as Americans can share what we do and show what America stands for in the world, because we know how to do this. This isn't a mystery, or we don't need to unlock some secret scientific formula. This is something we already know how to do, and we can share that knowledge.
I do have a quick question, if it's okay. Let's say the $100 million language does get set for this fiscal year 2022. What's the long-term goal? Is it to continue to increase that quantity further to continue the surgical capacity building across, or is it more like a thought of, as we continue to pour into these systems, that it becomes more independent and self-sustainable instead of continue to use the USAID funds?
Michael, did you unmute to respond?
Yeah, I'll jump in on that. So as Lismore stated, we're planting an acorn to grow into an oak tree. And we anticipate that this first $100 million is just the beginning of a fund for global surgery. He and I have talked often about creating what we're referring to as a PEPFAR 2.0. PEPFAR has a current budget of $6.8 billion and has been the most successful global health program ever launched by a country in the history of the world, and has saved the lives of perhaps 20 million Africans, not to mention other people around the world. So with an estimated death rate of 17 million people per year for lack of access to global surgical care, we're going to have to increase our budget for the elimination of the surgical conditions that are listed, but also for the work that Harvard has been pioneering in developing SFOPS for nations around the world, because ultimately the burden falls to the government, the Ministry of Health, to prepare plans and put in the space, staff, and stuff that is necessary to ensure that their citizenry has access to safe, well-timed surgical care. So yes, our intent is to grow this over time. Neglected tropical diseases began in 2008 with a $15 million allocation, and it's taken them this long to get to $102 million. In an era of unprecedented federal spending, we felt that this figure of $100 million was appropriate. We were toying with the idea of 25 million. Somebody from USAID had a conversation with Dr. Park, and she said I would increase that. In fact, I'd double it. For what global surgery represents, you need to start with a larger figure. And it's sort of inched upwards to 100 million. So yes, this is just the beginning point, and we will watch it grow over time. Key?
Yeah, that was a great way to answer that question, Michael. I would only add that if we get that 100 million, right? The USAID will get it, actually, not us, but but the 100 million gets in the budget for next year. We want to have these countries that are developing national surgical plans to have projects that are ready to go, written up in a proposal format. These are discrete projects, but it's part of the national surgical plan, but it's achievable in a short time frame, sort of like quick wins, low-lying fruits. Because what we want is for the first year they allocate this money, we want to show that it's making a difference right away, so that they can continue funding it over time. So that's, I just wanted to mention that.
One other thing is, as we secure $100 million from the United States, that will be our launching point to go to other donor nations around the world and ask them to match that. So with the United States having the imprimatur of the United States behind global surgery, we'll go to other donor countries like Korea, Japan, UK, Germany, France, Scandinavia, and ask them to match it. So we have a lot of work to do, not only in our own country, but around the world.
Maybe I should also clarify that we're not trying to raise money or use US taxpayer dollars to solve all of the unmet surgical needs in the LMICs. Most of the costs will be borne by the governments themselves through raising taxes or other ways of financing and using domestic resources. The funding that we're arguing for is external assistance in those countries where they need additional support at the beginning, or catalytic funding to get the things going, strategic planning, those kinds of things. So we're not, trying to say the U.S. should fix everybody's surgical needs everywhere.
Thank you, Key and Michael, for all of that information. I think it puts it into a really good perspective that this is a tree that's going to grow, but it's also, only a small part of everything that we have to do. And Vincent, thank you for the point that this is truly a bipartisan effort. And I think that's the really awesome part about students and trainees being involved in this is that, no matter what state you live in, there will be someone there that you can reach out to and advocate for this, and it's really important that we do that at a national level. And also this is something you can ask your family members to write in about, ask your partner to write in about. I have found that the best way as a student advocate also is to send out individual text messages, link them to our website, and say it's going to take you 10 minutes to do this. This is something I really care about. I'm a part of a global surgery student organization. I'm doing global surgery research or advocacy work, and chances are if they're a family member or close friend, they already know that about you. And so I have found people are super willing to get on board, and being able to ask them that question and that request personally is a lot more powerful to those folks than it is coming from me or someone else that they have no idea who that is. So I definitely encourage you all to get involved in that way. I see that John Rose has raised his hand. So go ahead, John.
Hi, thanks so much. I have a question for whoever thinks they are most appropriate to answer it. A couple of you have touched on the topics of surgical system strengthening, and even the language that was presented in the most recent fiscal year had some of that. My question is, in what order you envision going about implementing some of these changes, because the language is centered around a few discrete disease or pathological states. I wonder in what order we develop things such as data infrastructure. We know that, for example, the SFOPS rely on vital statistics in surgery, some of which were outlined in the Lancet Commission, some of which have been advocated for by the G4 Alliance. And my question is, in what way we would be able to build a data infrastructure around the SFOPS such that we can not only have a baseline from which to launch in these countries, but also something with which to monitor as we go forward with implementation and then expand into other pathological states.
Lismore, do you want to talk about our experience with AHME in Seattle?
Sure. I mean, I think to answer your question, that hasn't been decided yet. I think we started with these conditions because it's where Michael and I came in on this level, and we wanted to eradicate the backlog of surgical disease for these conditions, and then was introduced to the global surgery community, and we expanded upon that to bring in the surgical system strengthening, as well as the national surgical planning. IHME, if any, I'm sure all of you are familiar, the Institute for Health Metrics and Evaluation, are continually adding more and more conditions and burden of disease to their catalog. And after interacting with them and going to their conference in Greece, we were in this place of the non-communicable disease focus has never been brought to any high-level political engagement. And while Ambassador Kolker mentioned the fistula program, this is the first time any of these other conditions have been at all mentioned in a US government appropriations bill. So this language was landmark. The trajectory of it and the direction of the things that you mentioned of data sourcing and prioritization of conditions has not been determined yet. And I think it will depend on when a funding allocation comes. We are requesting $100 million. They have the opportunity to cut that number in half or in a third, or change it, or adjust our language, or take out sections. So trajectory is hard to speak on at this point. Ambassador Kolker, I don't know if you'd like to add anything to Mr. Rose's question about where this is going to go and how it's going to be organized.
Yeah, I'll add just a couple things. He seems very well informed because G4 Alliance indeed has as one of its priorities, not through this appropriations bill, but in other funds and trying to mobilize other partners to actually get some sort of registry and to standardize the kind of information that's reported. And we're trying to work with the World Health Organization through the GIEESC program that they have on supporting surgery to try to get some norms established and to be sure that the data collection is consistent with the Sustainable Development Goals, consistent with other things that countries are collecting for WHO as part of health system strengthening and universal health coverage. So it's a complicated landscape, and we're aware of that. I think that the advantage of the way the appropriations process works is that USAID responds to stimuli. And if there are proposals in a particular country to, as Key mentioned very effectively, that are teed up for this, they're able to have a shovel-ready program, something that's ready to go, and they have some of their partners in place to do data collection, to do some accountability, but also to have the personnel for capacity building, to have facilities that could respond to that, where money is a key component in being able to accomplish what they already have in mind to do and already have some capacity to do. This really is magical because there is not right now global money going into surgery. And to even have $100 million, even if there were 5 million in one particular country to start the implementation of an NSOAP or to be sure that the consultation process and the data collection process is standardized nationwide and scaled up for something like that, even for just some aspects of surgery, would be a major breakthrough. So the question's very good. And this legislation, this language wouldn't require or prevent countries from doing this any different way or USAID from doing it. But I think there are a number of factors coming together that this could catalyze to do it right.
You know, Ambassador Kolker, you said John Rose sounds like he knows what he's talking about. I can tell you he does, because Dr. John Rose is a trauma surgeon at Hopkins, but was one of the key researchers for the Lancet Commission report. He's the one that came up with the 143 million operation deficit. So, John, I had to out you here. So, but I would answer this. You know, we actually, Ambassador Kolker arranged a meeting with the USAID at the acting director for Global Health Bureau. And we anticipated that the USAID will be puzzled about what to do if they got all this money. So we sort of gave them a scenario. You know, if you got this money, here's how we would envision you spending it. And we said half the money should go towards reducing the backlog. So these are the named conditions in the first half of the wording, but the other half should go into more of a strategic funding for national surgical planning and surgical system strengthening. Yeah.
Thanks so much for your responses. Thanks, Key, for outing me there. I'm totally busted, guilty as charged. But I absolutely love everything I'm hearing. Thank you so much to all the organizers of the meeting, because we recently published our vital statistics in Mozambique, where I've been working for 8 years, and it took us all of 8 years to get through all the political obstacles. And even with MEPI funding from PEPFAR funds and then HEPI funding through the NIH, we still just had insurmountable barriers that made it take way too long. And what we hope is that an initiative like this would allow not just Mozambique, but other countries like them, and in the entire SADC as well, to really move faster along that trajectory of taking meaningful information and then turning it into policy documents that can then ultimately lead to change. And so I see this as a huge step forward. Really, really appreciative to all the organizers for including us on this. Thanks.
I'll just add quickly that, the GSSA, group has been sort of the torch that's been lit behind us. But, the group of us that have been talking about this and are on board, we have, ACS, they're putting all their weight behind it. This is American College of Surgeons. They have access to, they lead a coalition of all the surgical societies. This is anesthesia, all the subspecialties. And they've got, I think, more than half the societies already signed on to this. We have academia like us. We have advocacy organizations with G4. They have like 70 organizations that they can rely on. And we have industry. We have J&J and GE Healthcare, both mobilizing their government relations office to support this. So this is not just a flash in the pan. We really do have a coalition. I think the possibility is just tantalizing for me.
This has been awesome. Thank you so much for those comments, for the questions. I think one question I did want to touch upon real quickly, just because I know about people who are going to be watching this recording at a later date, is that, GSSA is a part of a much larger international network of students and trainees, which is called Incision, or the International Student Surgical Network. And so in terms of our non-American friends, peers, colleagues, all of that giant community out there, what are tangible ways that they can support this process as well? I know that, there's obviously specific ways within their own country that they can influence their own governments to put funding towards it, but then also, is there any impact that they can have in terms of the USAID process and funding from here?
I think one concrete way is to join your colleagues. I think it's been wonderful to see some constituents bring in global surgery colleagues, folks from the Global South working in low-income countries, to talk about the challenges they see every day. And I think that's really powerful, because members of Congress and their staff very infrequently get an opportunity to hear directly from practitioners and surgeons. And I think if you're able to leverage your residency here, not the formal medical training program, but your physical presence, I think that can be really powerful, and creating an opportunity or a platform for some of our global colleagues to have a voice with Congress as well, because they are the experts, the folks who are on the front lines. And so opening up those opportunities would be great. And members of Congress are excited to hear directly from the people who are affected, and they don't always get that opportunity.
Anyone have any other insider comments? I think this is definitely going to be a big working piece, trying to find out more information about how we can bring our colleagues in who are, living this on a day-to-day basis. And it's an important part of like global health solidarity, I think. All right, I know that we are about a minute over 9. Do we have any other burning questions before we wrap up? Okay. So just to wrap up, I do want to ask if, everyone could perhaps tweet. What I'm going to do is put a sample tweet in the chat. And if everyone could tweet that out, that has a Twitter, that is, that would be an incredible step forward. We have more of these like sample tweets in our advocacy toolkit. As well as that, I'm going to challenge everyone, the 5 minutes after this ends, write a letter if you haven't already. You've heard everyone talk here about the energy that's going into this, the important steps that are going forward. So take those few minutes after this webinar ends to like write that letter. If you can write 3, I promise you it takes less and less time each time you're writing one. We already have 60 letters that have been submitted since we launched on Monday night, which has been really incredible. And, if you're able to write a letter, like I said, get your family to write a letter, get your partner to write a letter. If you have kids that are of age, also like get them to write letters in, get your classmates to do it. Anyone who's interested in surgery or not, everyone can be a part of this movement. Please feel free to direct anyone towards the GSSA website. That's the reason we had both the GSSA letterhead and the generic letterhead letters put on the website, was so that, anyone would be able to use it. And the language that's in there is already, really, it includes the like specific language that the team is asking for in the fiscal year 22 bill. And that's really what's important in there. Otherwise, you are welcome to amend the letter as you want. And if you are able to secure a meeting with any of your elected officials, let us know. We're happy to put you in touch with the right people so that you have the right talking points. It would also be awesome to be able to connect you with some students or trainees in LMIC to attend those meetings with you, or if you already have ongoing partnerships, I think that would be an awesome way to bring them into the fold. If you have any other questions, feel free to reach out to us, tweet at us, email us. We're happy to provide like any support. I think having this huge coalition of voices is going to be what pushes this movement forward. And I think it's so important for medical students, for dental students, for anyone in healthcare to be an advocate nowadays. I think our patients deserve it. And, for humanity around the world deserves it if we truly believe in surgical equity worldwide. So thank you so much to everyone who spoke today. Thank you to Lismore for giving us an amazing overview. Thank you to Vincent for breaking it down. I have learned so much from you just in the last 2 weeks. Thank you to Tara and the whole advocacy team for putting all of this content together. I think it's been an amazing stepping point. Key, thank you for just, everything that you bring to this project, the energy. I've also learned so much from you. Ambassador Kolker, thank you so much for making it here today. It was such a pleasant surprise to see you attend. And Michael and also Dr. Hoemeke, who was here before, thank you both so much as well for being here, for the support. And we hope that we're able to rally everyone together to, get this through for this next year. And then also to continue working on this in the years to come, so that we can ultimately achieve, surgical access for everyone around the world.